Have you ever been told that once your kidneys reach stage 4 or 5, it's all downhill from there? That dialysis is just around the corner, and there's nothing you can do to stop it? Well, what if I told you that many kidney patients are now reversing their decline, not with pills, not with surgeries, but with a simple, personalized strategy that starts right in their kitchen? In this video, we'll uncover a clinically proven method that's helping CKD patients lower creatinine levels, reduce proteinuria, and even boost their eGFR, some by over 60% in just a few months. And no, it's not a fad, it's not a scam, and it's not just another generic low-sodium lecture. If you're living with chronic kidney disease or caring for someone who is, this could be the most important 20 minutes you spend today. Let's dive in. The most effective way to reduce creatinine and proteinuria. When patients reach stage 4 or 5 of chronic kidney disease, CKD, they often feel like time is running out. The looming shadow of dialysis can feel inevitable. But what if there were a way not just to slow kidney decline, but to actually reverse key indicators like proteinuria and elevated creatinine? Recent findings and clinical experiences point to a groundbreaking solution: a personalized renal diet tailored to an individual's exact medical condition, lab markers, and nutritional needs. This isn't your average low-sodium, avoid red meat plan. It's a targeted, evidence-based dietary strategy that can lead to measurable improvements in kidney function in just weeks. Microscope Scientific Foundation, Low Protein, High Potential. The backbone of this approach is a carefully monitored low-protein diet, enhanced with key anti-inflammatory and renal supportive foods. Numerous studies, including a landmark trial published in Nephrology Dialysis Transplantation, have shown that low-protein diets, when personalized, can reduce proteinuria by as much as 70% and significantly improve estimated glomerular filtration rate, eGFR, over time. One such case involved a patient with an eGFR of just 45 milliliters per minute. After adopting a personalized plant-based renal diet, their eGFR increased to 74 milliliters per minute within 4.5 months, an astonishing 64% improvement. Their proteinuria also dropped from a dangerous 414 milligrams per deciliter to just 26.8 milligrams per deciliter. These numbers are not anecdotal, they reflect a shift from progressive disease to potential stabilization and even partial reversal. But why does this work? Lower protein intake reduces the nitrogen load on the kidneys. Plant-based foods are anti-inflammatory and promote endothelial health. Tailored nutrient ratios help manage comorbidities like diabetes and hypertension. Brain expert insight. From a nephrologist's perspective, the genius of this diet lies in how adaptable it is. Unlike traditional kidney diets that apply a one-size-fits-all model, a personalized renal diet evolves with the patient. As lab values change, so does the diet. Protein, potassium, phosphorus, and calorie levels are all modulated based on real-time needs. This flexibility is key. CKD is not static, and neither should your diet be. Speech balloon personal commentary. I've seen many patients frustrated by generic diet advice, often too vague or too strict. The magic happens when we align medical precision with patient lifestyle. When someone finally eats a diet that fits their body, their labs, and their energy, transform. Patients report less fatigue, better sleep, and a surprising boost in mental clarity. If there's one thing that can dramatically change the course of kidney disease, it's not a miracle drug or an exotic herb, it's personalization. Most people don't realize that kidney disease isn't a single path. Two people with stage 4 CKD can have entirely different lab profiles, symptoms, comorbidities, and even goals. One might be diabetic and overweight, the other lean with dangerously low protein levels. How could the same diet possibly work for both? The answer is, it doesn't. Clipboard: Why personalization matters in CKD. A traditional renal diet often comes in the form of restrictive checklists: no potassium, avoid sodium, limit phosphorus, watch your protein. But in clinical practice, these generic rules fail to account for the thousands of biochemical variations each patient presents. What makes the personalized renal diet radically different? Dynamic adjustments based on lab results, creatinine, BUN, potassium, phosphorus, blood sugar, blood pressure, albumin, GFR. Consideration of coexisting conditions, diabetes, hypertension, malnutrition, inflammation. Lifestyle integration, cultural eating habits, access to ingredients, economic constraints. Instead of treating food as an enemy, personalization reframes nutrition as medicine, precise, adaptable, and sustainable. Broccoli not just plant-based, smartly plant-based. All the diets used in this personalized approach are centered around whole, plant-based foods, but they are far from generic vegan diets. The plan changes depending on protein leakage levels, proteinuria, serum potassium, body mass index, BMI, blood sugar control, HbA1c, caloric needs, weight loss or gain. For example, a patient with high proteinuria may benefit from turmeric and flaxseed. Studies published in Kidney International have shown that turmeric's curcumin component can reduce protein levels by modulating inflammation. Flaxseed, rich in omega-3 and lignans, is also known to reduce protein leakage and improve endothelial function. On the other hand, a diabetic CKD patient might benefit more from okra, which helps regulate post-meal glucose spikes thanks to its viscous fiber, and bitter melon, a staple in Asian diets. That's shown to reduce HbA1c and support insulin sensitivity in multiple clinical trials. Speech balloon personal commentary. When patients hear plant-based, they sometimes panic, assuming it means bland tofu and endless spinach. But personalization allows for creativity. One of my patients, a South Asian woman with diabetes and CKD, built her entire diet around okra curry, bitter melon stir-fry, and lentil soup, with real clinical improvement. She didn't feel deprived, she felt empowered. And that's the goal: liberate patients from rigid, generic rules and guide them toward choices that are healing and culturally familiar. 3. Caloric precision, customizing CKD diets with and without diabetes. When it comes to kidney disease, calories aren't just about weight, they're about survival. Patients with CKD often find themselves on a tightrope between too much and too little. Too much sugar can worsen diabetes and inflammation, but too little fat can cause dangerous calorie deficits, especially in underweight individuals. The key is not simply reducing or increasing calories, it's delivering them in a metabolically intelligent way. Stethoscope personalization for CKD patients with diabetes. If you have diabetes alongside CKD, your kidneys are under dual assault. High glucose damages the delicate glomerular structures, while poor filtration exacerbates insulin resistance and inflammation. That's why your diet needs to be carefully calibrated, not only for what you eat, but how your body processes it. Foods to avoid include sugary cereals and snack bars, energy drinks and fruit juice, pastries and white bread, and surprisingly, pure added fats, including oils. Yes, you read that right. Even so-called healthy fats like olive oil or avocado oil can sabotage diabetic CKD patients, not because they're inherently bad, but because they pack an enormous calorie load without offering enough satiety or fiber. Just 2 tablespoons of olive oil contain about 250 calories, more than half a cheeseburger. And unlike whole foods, those calories come without fiber, protein, or bulk, making them a silent contributor to weight gain, insulin resistance, and metabolic stress. Chart decreasing the hidden caloric trap. Many patients make the mistake of pouring olive oil on salads thinking it's a healthy move. But in reality, they're turning a 200-calorie meal into a 500-calorie bomb with a few tablespoons of oil. Calories are neutral agents, they don't care where they come from. Whether it's from coconut oil or candy, the total intake determines your weight and glucose trends. This is a hard truth that many health influencers overlook. Fork and knife with plate: practical recommendations for diabetic CKD patients. Avoid added fats, skip oils, butter, ghee, and high-fat sauces. Get your fats from whole sources like nuts, seeds, in moderation, or avocados. Increase fiber-rich vegetables. These help slow glucose absorption and stabilize insulin levels. Choose low glycemic carbs, lentils, quinoa, steel-cut oats. Lightbulb fun fact: research from the Journal of Renal Nutrition shows that even small changes, like replacing olive oil with avocado slices or tahini, can improve insulin sensitivity in CKD patients over just 8 weeks. Spoon personalization for CKD patients without diabetes, especially underweight. On the other side of the spectrum, we have patients, often in late-stage CKD, who suffer from severe weight loss, poor appetite, and malabsorption. For them, the primary threat isn't sugar or fat, it's calorie deficit. These patients are in danger of protein energy wasting, a catabolic state where the body breaks down its own muscle for fuel, leading to malnutrition, inflammation, and increased mortality. In such cases, added fats are not enemies, they're allies. Avocado rebuilding with fats, when calories mean survival. High-calorie, nutrient-dense foods are essential. Olive oil, extra virgin, anti-inflammatory and easily digestible. Avocado oil or flax oil, great for skin, gut, and brain. Nut butters, almond butter is excellent for magnesium and heart health. Margarine, not ideal, but better than starvation in advanced cases. These foods provide dense energy in small portions, which is crucial for patients who can't eat large meals due to nausea or reduced appetite. Even simple sugars and refined carbs, often demonized, may be strategically used to keep energy intake up. In cases of severe undernutrition, white rice and pasta may be less risky than continuing a caloric deficit. Speech balloon personal commentary. This is where so many people get confused. They assume that sugar, fat, and white carbs are always bad. But context is everything. A diabetic patient should avoid margarine. But a 90-pound patient with CKD and no diabetes, struggling to eat, may survive because of it. I've worked with underweight patients who were terrified of eating pasta or adding olive oil, because social media told them those were bad. But after helping them understand the metabolic need for calorie density, they stabilized their weight and energy levels. One patient even started painting again because her strength returned. This is not about trends, it's about life-saving personalization. 4. Essential supplements for a renal diet, guarding against deficiency in stage 4 to 5 CKD. Adopting a low-protein, plant-based renal diet is one of the most powerful tools to slow kidney decline. But like any powerful tool, it must be used wisely. Because when you cut protein and eliminate most animal products, you're not just lowering toxins, you may also be unintentionally removing key nutrients vital for survival. Let's talk about the nutritional gaps that can arise, and how to fill them safely and effectively. DNA 1. Vitamin B12, the silent deficiency. Vitamin B12 is essential for red blood cell production, DNA synthesis, neurological function. The problem? There are no natural plant-based sources of B12. None. Period. And B12 deficiency doesn't just cause fatigue, it can lead to permanent nerve damage and cognitive decline. Magnifying glass tilted right study highlight. A 2020 paper in the Clinical Journal of the American Society of Nephrology found that over 60% of CKD patients on plant-based diets had suboptimal B12 levels within 6 months unless they were supplementing. Lightbulb practical tip: use methylcobalamin or cyanocobalamin forms, depending on individual absorption ability. Sublingual tablets or sprays may be better absorbed in CKD patients with gut issues. Brain 2. Omega-3 fatty acids, anti-inflammatory allies. Yes, flax seeds and walnuts contain omega-3, but mostly in the form of ALA, alpha-linolenic acid, which must be converted in the body into the usable forms, EPA and DHA. In CKD patients, this conversion is highly inefficient. Why does this matter? Omega-3s reduce inflammation, which is a major driver of kidney scarring. They help lower blood pressure and reduce triglycerides. They improve heart health, a top priority for CKD patients. Microscope Research Insight. The American Journal of Kidney Diseases recommends supplementation with EPA and DHA directly, not relying on plant conversion. Warning: avoid fish liver oils like cod liver oil, which may contain excess vitamin A, toxic for CKD patients. Test Tube 3. Zinc, the overlooked mineral. Zinc is required for immune function, wound healing, hormonal balance, taste and appetite regulation, which is crucial for underweight CKD patients. Yet it's notoriously low in plant-based diets. And even if you're eating pumpkin seeds, lentils, and quinoa, the bioavailability of zinc is lower due to phytates, compounds in plant foods that block absorption. To make matters worse, common CKD medications like phosphate binders and iron supplements further impair zinc uptake. Lightbulb practical tip: use low-dose zinc supplements, 15 mg/day, unless advised otherwise. High doses can interfere with copper absorption. Syringe 4. Keto Analogues, the game changer for stage 4 to 5. This is where advanced nephrology meets precision nutrition. When you reduce protein to protect the kidneys, you also risk not getting enough essential amino acids, the building blocks your body needs for tissue repair, immune health, and more. That's where keto analogues come in. Keto analogues are nitrogen-free versions of essential amino acids. They provide the protein building blocks without the nitrogen waste. Reduce protein energy wasting. Delay dialysis by reducing uremic toxins. Glowing Star case study. In a 2019 clinical trial, patients taking keto analogues alongside a low-protein diet delayed the onset of dialysis by an average of 11 months compared to those on diet alone. Brands like Ketosterol, Prescription, Albutrix, and Corina are commonly used. Fuse is another high-quality brand, though it usually requires a doctor's prescription. Warning: these supplements should never be self-prescribed. They require professional guidance to match dosing with dietary intake. Speech balloon personal commentary. Too often, patients jump on the plant-based bandwagon with good intentions but poor planning. A few months in, they feel tired, foggy, and weak, not because the diet is bad, but because it wasn't supported with the right supplements. I've seen patients go from borderline dialysis to stable CKD just by combining a customized renal diet with targeted supplementation. In fact, many start gaining strength, appetite, and even confidence in their recovery once deficiencies are corrected. The goal isn't just to eat less protein, it's to protect every cell of your body while doing so. 5. Avoiding the trap of malnutrition, the line between healing and harm. A low-protein renal diet is one of the most effective interventions for preserving kidney function, especially in advanced stages. But like any medical strategy, when applied carelessly or without supervision, it can become dangerous. The biggest threat? Protein energy wasting, PEW, a clinical condition where the body lacks both sufficient protein and calories to maintain basic cellular function. This condition affects up to 40% of patients with stage 5 CKD, according to the Journal of Renal Nutrition. And it's not just a number, it's a slow collapse of the body's metabolic foundation. Magnifying glass tilted left: signs of protein energy wasting. Rapid, unexplained weight loss. Muscle wasting. Low serum albumin levels. Chronic fatigue. Inflammation or frequent infections. Poor wound healing. Loss of appetite and strength. For patients in late-stage CKD, especially those experiencing nausea or food aversion, undereating becomes the true enemy. In this context, even the cleanest, most anti-inflammatory diet can backfire if it lacks calories and essential amino acids. Shield: 2 proven ways to prevent malnutrition in low-protein diets. White heavy checkmark 1. Ensure adequate caloric intake. When protein is reduced, calories must increase proportionally to avoid catabolism. This often means using healthy fats liberally, only if not diabetic. Incorporating simple carbs strategically to boost intake. Choosing nutrient-dense snacks like nut butters, smoothies, and porridges. Eating frequent small meals to combat nausea or early satiety. Lightbulb: remember, for patients without diabetes, even white rice or sweet foods may be better than calorie deficits. It's about context, not dogma. White heavy checkmark 2. Supplement with keto analogues. As explained earlier, keto analogues are a safe way to supply all essential amino acids without taxing the kidneys. They bypass the need for protein digestion, prevent muscle breakdown, support healing and cellular maintenance, lower nitrogenous waste products, urea, creatinine. This combination, low protein plus keto analogues plus enough calories, is now recognized as the gold standard in many nephrology clinics worldwide to delay dialysis and maintain patient quality of life. Clipboard: who should not follow a low-protein plant-based diet? Despite its benefits, not every CKD patient is a good candidate for this approach. Avoid or modify the diet if the patient is severely underweight and unable to meet calorie goals. There's a history of malabsorption syndromes. Serum albumin is chronically low despite intervention. There's active infection, surgery recovery, or severe anemia. The patient refuses or cannot afford supplements. Warning: in such cases, a moderate protein diet or blended approach may be safer. Speech balloon personal commentary. This is where patient education is crucial. Too many people hear low protein is good and cut too much, too fast, without calories, without supplements, without guidance. It's not their fault, they're trying to take control. But healing kidneys requires precision, not just restriction. One of my patients, I'll call her Maria, was losing weight rapidly. She was eating kale, apples, and rice crackers, thinking she was doing it right. But her GFR dropped, not because of damage, but because her body was in starvation mode. Once we added calorie-dense foods and keto analogues, her labs rebounded, and her spirit came back with them. This is the difference between surviving and recovering. Your kidneys may be struggling, but they're not giving up. And neither should you. What you've learned today isn't just theory. It's the reality that thousands of patients are experiencing right now. Real improvements in kidney function. Reduced need for dialysis. Renewed energy, clarity, and hope. All from a diet that's designed not to restrict you, but to support your healing at every level. But remember, the key isn't just the food, it's the personalization, the right supplements, and most importantly, the right mindset. You are not helpless. You have options. And your body is capable of amazing things with the right guidance. Backhand index pointing right. If this video gave you new hope or insight, please subscribe to our channel, The Healthy Organs, for weekly deep dives into kidney health, nutrition, and evidence-based healing strategies. Bell: turn on notifications so you never miss a video that could change your life. Speech balloon: and don't forget to share your story or questions in the comments, we'd love to hear from you. Until next time, take care of your kidneys, and they'll take care of you.